We do need to go back to the World Health Organization definition of health as set out in the same year, 1948, as the NHS was created. Health is, quote, a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Trying to rise to 21st century challenges with a 20th century mindset, we're going to come up with the wrong answers.
We do great things like more social prescribing, more use of personal budgets, stronger community leadership. What it will mean is that we change the whole conversation with people so that we focus on their strengths, not just their needs.
We believe that volunteering has a huge role to play in helping communities be more active and healthy, and we can do a lot to work with public services to take the pressure off those frontline services.
Well, social prescribing is just a way that our health and care services can connect people with community groups and activities that are based around exercise, arts, peer support, anything that really is about people looking after themselves and looking after each other in the communities better than relying on medicines.
Now it may be an Itinata group in the cafe, joining a reading group or a theatre group or even a yoga group. It's an opportunity to find out what inspires that person. We're all different.
If you listen to somebody about what's important to them, and then the whole system can work around that.
In a very short, consultation, we need to have ready access to whatever services it is that our patient will need, or somebody who can navigate our patients through the system on our behalf. But I still think that we're fundamental in terms of the relationship and unpicking with patients what matters for them.
My name is Sami, I'm 17. I have autism.
Thank you, Ben.
I'm doing on my own, don't need Bens anymore.
Other people need to know that there's things available there, how to access them, and I think it doesn't have to all be medical, GPs, doctors. I think if we work good as a community, we can get there as well.
I think what goes into a good life is people being in control of it, having access to the support they need, being able to do the things they want to do, to make choices.
It's important that we work together as a team so people with all sorts of long-term conditions can come together and the voice is much stronger.
The groups that I go to, I found them very therapeutic. And I think people need them because you need to get out, you need to live and to have a laugh.
To get out there and socialise to prevent things like depression and isolation is really, really important.
We have to learn to trust our communities and help them to find their own solutions.
We needed something that was more value-based. We've managed to build fantastic relationships with the district nurse, with the GP. He has much less medical input, but a hugely different quality of life.
The sooner we start getting on with this stuff and making it happen and challenging each other to improve, that's when the difference will really come through.
There's also this really crucial issue of how we make sure that the VCSE sector is properly supported and financed to deliver it.
It's refreshing to have an opportunity to try and change the mindset around a more salutogenic approach to care.
I don't think this is happening anywhere else in the whole of the country. They're supporting people holistically to help them have better lives.
To hear some of the leaders across Greater Manchester really echoing how important the voluntary sector is. Now we need to move things systematically to actually support people to take more control and have more power.
The spotlight is on us. A lot of people out there relying on us to bring forward that new 21st century thinking and therefore to show it can work as well. What an opportunity.